Hey, Dr. Kran again today here, and I'm going to talk about why cancer screening matters. Um, it's really um, important to get cancer screening done. I've been in practice for 30 years as an internist. I've seen firsthand people diagnosed early with cancer and being cured. And one of the person was um, a nurse who was working with me many years ago, and she was diagnosed with colon cancer at an early age. And several people have been diagnosed with breast cancer, detected early, um, and cervical cancer as well, lung cancer as well. So let's just touch the base here. So the word cancer is scary, but screening allows us to detect it early before symptoms appear, when treatment is far more effective. And in screening, we know that it reduces both morbidity and mortality. It's not about fear, it's about empowerment. So, what are the general principles of screening? A good screening should detect. The test should be for common cancer, it detects early, it's cost effective and non invasive or low risk. So, let's now break this down by cancer type and when to screen. So colorectal cancer, men and women, start at age 45. Options: you have colonoscopy every 10 years, you have a FIT test yearly or CT colonography every 5 years. Now we have a Cologuard which is done every 3 years. And earlier, if there's a family history and personal history of inflammatory bowel disease. Colonoscopy not only detects but it can remove precancerous polyps. Breast cancer for women, mammogram every 1 to 2 years, starting at age 40 to 50, depending on guidelines, and earlier with BRCA1 and BRCA2 mutation, and if there's a strong family history. Self exams are good, but mammography saves lives. Cervical cancer for women, starting pap smear at age 21, pap smear plus HPV co testing every 5 years, starting at age 30, and it stop at 65 if the history has been consistently normal. HPV vaccine protects but does not eliminate the need for screening. So get HPV vaccine done. It starts early in teenage and it's good till age 35, I think. Lung cancer for smoker and ex-smokers. Low dose CT scan yearly for adults between 50 to 80, and with somebody with 20 pack year history of smoking, or somebody who's currently smoking or quit smoking within last 15 years. Now, if you qualify, this scan can catch lung cancer early before symptoms appear. Prostate cancer for men, we do PSA blood test or we do digital rectal exam. We begin at age 50 for average risk, age 45 if African American or a strong family history. PSA screening is nuanced. It discusses risk and benefits with your doctor. Lots of doctors don't like to get PSA done, but most of us are still doing it. Skin cancer, all adults. Annual skin check if you're light skin, your family history of cancer, basal cell cancer, squamous cell cancer, melanoma, a history of sunburn. Self-monitoring for A, B, C, D, E of moles. Asymmetry, A for asymmetry, B for border irregularity, C for color variation, D for diameter more than 6 millimeter, E for evolving over time. Daily sunscreen is a simple way to prevent the most common cancer. Other cancer screening, pancreatic cancer only if genetic syndromes are present or very high risk individual. Ovarian cancer, there is no routine screening unless you are BRCA positive. Thyroid, testicular, and oral cancer, those are symptom based or physical exam only based. So I would say that I usually advise my patient bundle your checkups, get labs, mammogram, pap, colonoscopy, schedule once a year, usually during your birthday. And Natural health is powerful, but screening and diagnosis comes first, and supplements come later. So even if you're taking supplements to have a holistic health, that doesn't mean that you don't need to have a screening test done. So thanks for watching. Don't forget to subscribe for more videos. I like sharing small tips with you guys. Thank you for watching.